This episode of Doc Talk is brought to you by First Bank. We're not just your neighborhood bank, we're your neighbors. Our local team lives up to the name, putting our customers and community first. To experience First Bank difference, stop by any of our 13 Knoxville area locations or visit firstbankonline.com. First Bank, member FDIC.
Greetings. My name is Dr. Rob Page, and welcome to Doc Talk. Doc Talk is a podcast that is produced by the Knoxville Academy of Medicine and features its members to give information to patients to provide them with additional information they can use in terms of seeking therapy or additional information that they can have prior to going to seeing a physician. And I'm very pleased to have here with me today Dr. Carly Fowler. Dr. Carly Fowler is I say Carly Fowler because there's also a Daniel Fowler, which is your husband, who actually works with you. But Dr. Fowler is a dermatologist who works in the Knoxville area, and we are here today to talk about acne.
Yeah.
Welcome.
Thank you. Thanks for having me.
Well, I very much appreciate you coming and talking to me. So, when we talk about acne, so basically, give me a general background about acne and why a patient would need to come see you. Because acne is so common. Why would a patient need to go seek a dermatologist or professional to treat their acne?
So there's actually a lot of different types of acne, or a couple different types of acne. There is more adult onset acne, and then of course we have the classic teenage acne. And a lot of the times I get patients who come to see me because they're concerned about scarring, and they want to pursue treatment, or they've tried multiple over-the-counter treatments and nothing's really helping.
So you've had a patient. Let's say you have a young patient that comes into your office and they have severe acne or a bad case of acne. What are some general what do you generally suggest to the patient? Do you suggest any particular behaviors that they should engage in? Are there any kind of medications that you start off first line? What is generally like a first visit if I were to come in to see you and I had I was much younger than I am, and I had and I had my full face, and I had acne, I had fulminant acne. What would you tell me to do?
Well, when we talk about acne, it's multifactorial. So there's lots of different causes of acne, and you kind of have to treat based on the different issues that are causing the acne. So the first thing that happens in acne, for example, is you've got a plugged pore, and that's really genetic. And a plugged pore equivalent is like a blackhead or a whitehead. And so the pore gets plugged. And that's basically dead skin cells kind of built up around the pore. And then you have bacteria that kind of grow down. They live on all of our skin, but they grow down in the pore. And then, of course, there's sebum, which is oil. And sebum, the bacteria kind of feed on the sebum and cause a pimple. And if that grows big enough, then it causes a cyst. In addition, there's also hormones that play a role in that, both in teenagers and in women. I see a lot of adult onset female acne.
Based upon what's causing it, based upon the age of the patient, and based upon what you generally see in them. So what do you generally recommend the patients do in order to be able to treat their own acne?
To treat their own acne at home? Well, so there's a couple different good home treatments that you can use. So benzoyl peroxide is an over-the-counter ingredient that's good. It's in a lot of washes. It does bleach towels and clothes, so patients don't always like that. But the great thing about benzoyl peroxide, besides being over-the-counter, is that you cannot get antibiotic resistance to benzoyl peroxide. So using a benzoyl peroxide wash at home is always a good first step. You can also use benzoyl peroxide to wash the chest and back. So if someone's getting chest and back acne, that's another good place to start. And then the other area that you can do from at home is a retinoid. So now we have Differin that's over the counter. Retinoids teach the pore not to plug. So a retinoid is not a spot treatment. It's something that you put a thin film on your whole face at night. Usually they get inactivated by sunlight. So you want to use them at night. And retinoids are going to teach your pore not to make that blackhead or whitehead. So it's going to prevent that first step in forming the pimple.
So let's say that I'm a young male or a young female, and I've tried these. I'm using benzoyl peroxide. I've tried the over-the-counter retinoids, and they're not really doing anything for my acne. And then I come and see you. What sort of treatments would you offer me?
So we can also do prescription versions of topical antibiotics and topical retinoids, and then in addition, sometimes we'll add an oral antibiotic. Unfortunately, that usually requires a 3-month course, and so a lot of patients don't want to be on antibiotics for that long, and honestly, we don't really want patients to be on antibiotics for that long. So sometimes we'll do that to kind of kickstart the treatment, and then eventually try to get people on a good topical regimen. And then if there are hormones driving the acne, then we'll try to target the hormones. So a lot of times we'll put females on birth control. I see a lot of females with that kind of jawline cystic acne that's driven by hormones. Usually that's testosterone driving it. And so we'll use a medication called spironolactone. And spironolactone is a blood pressure medicine, but it also blocks part of the androgen, the testosterone pathway. So it can kind of, in low doses, block down that testosterone that's driving the hormone acne.
So you have those options available to you, and then you also have prescription retinoids.
Yes.
And so
we love prescription retinoids.
Now, the one thing I know about prescription retinoids is that it is not just something I would come into your office and say, hey, Dr. Fowler, put me on these prescription retinoids. It really requires a big commitment from the patient.
Yes. So the big one that most people have heard of is Accutane. And that's really the one that we go to, although it has multiple different other names. But Accutane is about a 6 to 8 month course. Patients have to sign up with this program called the iPledge program, and they have to log in to every month to get their prescription. So we have to counsel them in the office once a month. If it's a female, do a pregnancy test, commit to 2 forms of birth control. They have to log on and say that they were counseled, and then they can get their prescription. So it requires monthly visits. It requires blood draws. So,
and why are you drawing the blood?
So we're looking at liver enzymes and cholesterol mainly, but there are some other things too that are more rare. And it can cause a whole variety of side effects. Dries just about everybody out. Sometimes it makes the acne a little worse before it gets better because it's like purging all that stuff. And it can cause some kind of achiness, bone pain, joint pain type stuff, headaches, vision changes. There are some studies that correlate Accutane with IBD, inflammatory bowel disease, so like Crohn's or ulcerative colitis. Those studies are correlation studies, so they're not really that great, and there really is not a tie showing that Accutane causes severe acne. It may actually be that patients with severe acne also tend to develop inflammatory bowel disease. So there are potential side effects.
Now, one of the other side effects that I know about that has actually been, I've actually seen it more in the news and it's been very popularized, is the link between Accutane and depression. Now, is this part of something you approach in the iPledge program?
Absolutely.
Is this something that you see frequently, or is this something that you've had a lot of experience with in your patients?
Yeah, so what tends to happen is if someone is prone to mood disorders, anxiety, depression, suicidal thoughts, or ideations, it can just kind of cause them to be a little bit more labile, so they might be slightly more prone to have a flare-up of one of those things. So it's something that we definitely keep an eye on. If someone has a history of severe problems, then we'll get like a psychiatrist involved, have them have monthly check-ins with their psychiatrist too. So it's definitely something that we talk about before we start the medication. But the great thing about Accutane is that it is a cure for acne.
Yep.
So 66% of people who go through their first full course of Accutane get a cure and never have to deal with acne again. So patients with like severe cystic scarring acne, patients who have had other treatments fail, those are great candidates for Accutane.
And not only that, but we talk about the potential effects of the medicine, but acne in and of itself can have huge psychological effects, especially among young people.
Yes, absolutely.
And it's not only from just a cosmetic basis, but you find patients who generally they won't go out, or they won't go interact with other people because it is such a it's so cosmetically displeasing to them.
Yeah. Well, and I have a lot of patients who their depression actually gets a lot better because they didn't want to go out and do social things because they were so worried about their, the way their skin looked and their scarring and stuff like that. And then you see this huge change, and it's like night and day. I mean, it's just it can make a dramatic difference in someone's life. So dermatologists love Accutane in general.
Now, why is that? Now, why is it that they like it in general? Just because it is such a good medication and it works so well?
Yeah, and it's a cure. I mean, everything else that we're doing for acne is more of a Band-Aid, so it's more of a controlling the acne, whereas Accutane is an actual cure. So
now, generally, how long do you have to be on Accutane? You know, from the time you start until the time where you actually see, you know, considerable results, and when you would actually stop taking the Accutane.
So most people, it's about a 6 to 8 month course, but it is weight based. So the amount of medication that you want to get in someone is throughout the course is based on their weight. So like for a 70 kilogram per patient, that's usually around 10,000 milligrams for a course. So the higher you can go on the dose, the faster they get done with the course. Some people have to be on it for a year to get all of the medication in because they can't tolerate the side effects.
And after that year, you would, you know, do you have any patients who generally relapse or have additional problems later on who may need to go on another course?
Yeah. So remember I said 66% of people get a cure. So there are those 33% who don't. Of those 33%, the ones who go on to do a second course of Accutane, 66% of those people get a cure. So the odds are really good. The people who I see flare more often, so remember we were talking about hormones? Those females with the hormonal pattern of acne, those tend to need something long-term to control the hormonal aspect of it. They get better.
And that would generally involve like the other therapies you mentioned, like with birth control pills or with spironolactone, or maybe even some of the antibiotics or topical therapies or any of the other stuff you talked about. So.
Yeah.
So when you originally started talking when we started discussing about the causes of acne. You talked about oil and bacteria, and you talked about plugging of the pores. I've heard, or at least I've heard, you know, some ideas about certain foods that may cause acne. Are there any food, you know, is it like greasy foods or like pizza, or are there particular foods that we know of that actually will elicit acne?
So that's a great question.
Yeah.
There have actually been a lot of studies that have gone into this. And the general consensus is no. So it used to be when I was a teenager, our parents were like, don't eat greasy food or you'll get pimples, you know. That's not really the case now that we've studied it. There is one food group that's been linked to acne, and that is dairy. And in my mind, it's, you know, is it the hormones that are in the dairy? But other than that, no. You eat all the pizza and all the chocolate you want to. It's probably not going to cause acne.
Yeah, well, I was going to say, well, maybe you shouldn't eat all you want to, per se.
Good point.
But at the very least, you know it's not going to be affecting your acne, not going to be affecting your face, because really, the factors that you mentioned are completely independent of anything that we might ingest.
Yes.
You know, or you know, something that might affect hormones, as you mentioned, milk. But other than that, it'd be straight, you know, completely independent. It's not greasy food, causes you get to greasy complexion and all these other type of things. So
not necessarily.
So we talked about juvenile acne. Let's talk about adult onset acne. Generally, is this something you find in males and females, or is this mostly in females, or are there certain circumstances under which males would start getting acne when they became older?
So I do see a lot more of it in females, and I don't know if that's bias because that's who tends to come in for it more. But males can get it too. And I don't know what it is, but sometimes males who do a lot of weightlifting, I can see a lot of acne in. And maybe hormones related there too.
So not necessarily, but now we know about there's a relationship between taking steroid hormones, like anabolic steroids, and those people getting acne. But even people who just lift independent.
Yeah, I've had some of those too, and I don't know what it is. I don't know.
So and then the females you mentioned, maybe it's due to the hormone changes as they start to get older.
Yeah. So I don't think we really know exactly, you know, what causes that, but there seems to be a shift in hormones as women get into their 30s and 40s. And when we let testosterone take over, even just a little, not even measurable, it's not enough to measure, but just that slight excess in testosterone can drive jawline type acne. And patients will particularly experience acne like while they're having their period, for example, and it's kind of cyclical. Those patients do really well with hormonal treatments too.
That's great. So a definite problem for juveniles, also for adults, which we can generally treat with a bunch of different therapies. So it shouldn't be something we should just throw our hands up and say, oh, we can't do this, or, you know, and I know that some people have said that they don't necessarily want to take Accutane because of the potential risk, but these are actually things that can be managed also.
Yeah, there's other treatments besides just Accutane.
So, Well, thank you so much for the information you've given to us about acne today. Dr. Fowler, you've been in the Knoxville area for a while, but you just recently set up a new clinic here in town. Is that correct?
Yeah, I did. With my husband.
With your husband. And so, and would you give us some information about that? Maybe tell us where it is and if you have a website.
Yeah. So Dr. Daniel Fowler and I have come together and started our own practice together. He's a plastic surgeon. He does plastic, reconstructive, and hand surgery. And I'm a dermatologist. Our clinic is called Knoxville Center for Dermatology and Plastic Surgery. And we are at 4319 Paper Mill Drive. Our website is www.knoxdermplastics.com, and you can find us on social media at knoxdermplastics.
I've seen you on there. You're on Instagram and Facebook, and that's correct. So I've seen you on there, and you have a lot of postings, a lot of good information on there as well.
Thanks.
Now, is there good information on the website too that can help me sort of indicate, give me some good information about acne, things that I can do maybe before I come see you?
Yeah,
excellent.
I think so.
Excellent. So we'll have all that information at the bottom of the screen so that you don't have to memorize any of that. That'll all be down there, and tell the patients where you are. And I'd like to thank you so much for joining me here today and educating us about acne.
Well, thanks for having me.
And with that concludes this episode of Doc Talk. Doc Talk is a podcast that is produced by the Knoxville Academy of Medicine and features its members giving information to patients about topics that are of importance to them, be they common, or be they unusual, or occasionally they're topical. And with that, I'd like to say goodbye and thank you for joining us here today.
This episode of Doc Talk is brought to you by First Bank. We're not just your neighborhood bank, we're your neighbors. Our local team lives up to the name, putting our customers and community first. To experience First Bank difference, stop by any of our 13 Knoxville area locations or visit firstbankonline.com. First Bank, member FDIC.